Medicare is about to pay for a device in your home that can monitor your blood pressure, your heart rate, and your weight 24 hours a day, 7 days a week using artificial intelligence. Now, most people on Medicare have absolutely no idea this already exists. And here's the part that catches a lot of people off guard. Whether your Medicare coverage pays for this may have very little to do with your health. It may have everything to do with which Medicare plan you chose for your health insurance coverage. And that is the part most people don't discover until their doctor orders something Medicare covers and their plan still says no, not yet. So stay with me to the end of this video because I'm also going to cover something completely separate but just as important. So at the end of this video, I'll discuss a type of insurance being sold heavily to seniors right now called medical evacuation insurance. So a lot of these policies are being sold based on claims about Medicare and helicopter ambulances that are misleading. And I'll explain exactly what Medicare does cover for ambulance services, including ground ambulance and air ambulance, so you don't get talked into a policy that you may not need. Hi, if we haven't met yet, I'm Matthew Clausen, CEO of MedigapSeminars Insurance Agency. We're a national Medicare insurance agency and our services are always free to you, the consumer. So in this video, I want to walk you through exactly what Medicare's new in-home AI monitoring benefit is, who it currently helps and who it may not help, and most importantly, who gets to decide whether you ever receive this benefit at all. And then at the end, as I mentioned, I'll cover what Medicare actually pays when it comes to ambulance services. So let's start with the basics. Remote patient monitoring, often called RPM, is not some futuristic idea. It's a Medicare-covered benefit that exists right now. Your doctor can order a device for you. That device might be connected to a blood pressure cuff or a continuous glucose monitor or a weight scale or a pulse oximeter. So that device automatically transmits your health information to your doctor's office. Artificial intelligence can flag abnormal readings, your doctor gets an alert, and you may receive proactive care without driving to an appointment and without waiting 3 weeks to be seen. So here's a simple way to think about it. Instead of your doctor seeing a snapshot of your health once every 6 months, your doctor may be able to see a live feed of certain health data. The AI watches that information even when your doctor's not sitting there looking at it. It watches it in real time and alerts the doctor when needed. And this is not the same as telehealth. Telehealth is usually a scheduled video call. Remote patient monitoring is your body sending data to your doctor automatically, whether you remember to do anything or not. Now let's talk about what Medicare actually covers today. Medicare Part B covers remote patient monitoring through a set of billing codes. Your doctor's office bills those codes, and Medicare pays when the rules are met. Here's how it works in plain language. Medicare covers the setup. That includes getting your device and training you how to use it. Then Medicare covers the monthly monitoring itself as long as your device transmits data for at least 16 days during the month. Now, your doctor's office can also be reimbursed for staff reviewing the data, flagging concerns, and following up with you when needed. Now, here's a 2026 change that could really increase the use of home monitoring. So CMS, the Centers for Medicare and Medicaid Services, finalized 2 new billing codes in the 2026 physician fee schedule, and that eliminates the 16-day minimum requirement for certain situations. That means even 2 days of monitoring data in a month may qualify for reimbursement under those new codes. So why does this matter to you? Because it may dramatically expand who doctors can enroll in these programs. It can help people with episodic conditions. It can help people who travel. It could help people who are hard to get into the office regularly. This is a quiet change, but it could become a significant expansion. Under Original Medicare, Part B generally covers 80% of this service after your annual deductible. If you have a Medigap supplement, such as a Plan G or a Plan N, your supplement may pick up the remaining 20%. In that situation, your out-of-pocket costs could be very low, and in some cases, it could be zero. But here's where it gets complicated. If you're on original Medicare with a Medicare supplement, remote patient monitoring works the way I just described. Your doctor orders it, Medicare Part B covers it when the requirements are met, your supplement handles the remaining 20%, depending on your plan. There is no insurance company standing between you and your doctor's recommendation with a separate prior authorization process. But if you're on a Medicare Advantage plan, the rules can be different. Medicare Advantage plans have separate contracts with Medicare, with CMS, and those contracts allow them to legally require prior authorizations for services that original Medicare may cover. And that can include remote patient monitoring. Your Medicare Advantage plan can decide which devices it'll approve, it can decide which companies it will contract with for those devices, and it can decide whether to authorize the service your doctor has ordered. And it can also delay that authorization. There's already evidence that some major insurance companies are scaling back remote monitoring reimbursements at the same time that Medicare is actually expanding this coverage. So think about what that means. Medicare may be expanding this benefit, but your Advantage plan may still be making a separate decision about whether you personally get access to it. So I think this story is going to frustrate a lot of people because the assumption most people make is that if Medicare covers something, their Medicare Advantage plan covers it the same way. And that assumption is incorrect. With something as important as continuous health monitoring, that's an assumption that you cannot afford to make. So before I go further, if you're finding this helpful, please hit the subscribe button below. I'm going to keep covering Medicare's expansion of AI in healthcare, including remote health monitoring, because this story is going to grow significantly over the next 2 years. And one quick reminder, at the end of this video, I'm going to break down something that we've been asked a lot about recently, and that is this medical evacuation insurance. People are being misled about Medicare benefits, and I'll show you what Medicare actually covers and when you may or may not want additional coverage. Now let's talk about the 4 players who control whether you actually get this in-home monitoring benefit. And when I say Medicare will soon pay for an in-home AI health monitoring, that is true. But whether you personally get access to it involves 4 different decision makers. The first decision maker is, of course, Medicare, the Centers for Medicare and Medicaid Services. And CMS is the federal agency that sets what Medicare will pay for and when, and CMS has issued a formal request for information about artificial intelligence in Medicare, which means the federal government is still figuring out these rules in real time. Medicare has also made one point very clear. AI cannot replace a live clinician yet. A human must still be involved. For most of us, that matters. In my opinion, even if AI can eventually do some parts of this better, most people are not ready to let AI fully replace a licensed human, especially in healthcare. The second decision maker is Congress. Some telehealth and remote monitoring flexibilities that expanded during COVID have been extended through December of 2027, but they're not necessarily permanent law. If Congress does not act, some of those expansions could change or revert. The story's not settled, and I will keep you informed as it develops. The third decision maker is your doctor. Remote patient monitoring must be ordered by a physician or qualified medical provider. Your doctor must decide if it is medically appropriate for you. But there's another issue. Not every medical practice is set up to bill these codes. Many smaller practices and solo physicians do not yet have the infrastructure to run remote patient monitoring programs, especially considering that the data transmission and monitoring must remain HIPAA compliant at all times. So even if your insurance coverage is perfect, you still may not get access if your doctor's office isn't ready for it and they don't offer the program. And this is where the conversation moves beyond Medicare billing and into privacy data control and who's allowed to see your health information. So the fourth decision maker is the data company. And this is the part that concerns me. Many AI-powered home monitoring programs are operated by private technology vendors. These vendors may work with hospitals, physician groups, or Medicare Advantage plans. HIPAA provides important protections, but patients are often surprised to learn that health data may be shared among providers, insurers, and technology partners for treatments, for payment, for healthcare operations, and in some cases, de-identified data may also be used to improve the algorithms or develop new predictive technologies. Many healthcare technology vendors may also have foreign involvement. They may develop software overseas, they may use foreign programmers, they may rely on global cloud infrastructure, they may employ international data scientists. Now that does not automatically make the company illegal or unsafe. If they're handling protected health information for a U.S. healthcare provider or Medicare Advantage plan, they generally must comply with HIPAA contractual requirements through what's called a business associate agreement. But there's no absolute prohibition against foreign involvement. A company could be U.S. owned, foreign owned, or have overseas employees or contractors as long as the applicable legal requirements are met. Now, I personally would never tell anyone to sign up for one of these programs without understanding who holds their health data and what they're doing with it. With Medicare, the details always matter. And the details around data ownership and AI healthcare monitoring are still being worked out. So what does this mean for you specifically? If you're turning 65 or if you are in an enrollment window, here's how to think about this. Under Original Medicare with a Medicare supplement such as a Plan G or Plan N, if your doctor orders remote patient monitoring, it's covered under Part B, and your supplement will cover the 20% remainder. There's no prior authorizations from a private Medicare Advantage plan. There's no restricted vendor list created by the plan. Your doctor makes the medical recommendations. If you're on a Medicare Advantage plan, here's the question you need to ask now, not later. Does my plan cover remote patient monitoring under CPT codes 99453 through 99458? That question will tell you more about your plan's real coverage than any of the marketing material. If you already have a chronic condition such as high blood pressure, diabetes, heart disease, or COPD, you may be one of the primary types of patients this program is designed to help. You may also be one of the people most likely to face prior authorization delays if you're on a Medicare Advantage plan. So now let's talk about the financial side, because this is where it becomes real. A hospitalizable event that remote monitoring might catch early before it becomes an emergency can be very expensive for Medicare and for the patient. The monthly out-of-pocket costs for this same benefit for someone with Original Medicare and a strong Medicare supplement plan could potentially be very low. And that is exactly the type of benefit a well-designed Medicare supplement was built to help unlock. And here's the bottom line on remote patient monitoring. Medicare is expanding coverage for in-home AI health monitoring. That is real. It's already happening under current law, and the 2026 rule changes make it even more accessible than ever before. But Medicare covers it, and your plan covers it are two different sentences. If you're on Original Medicare with a Medicare supplement plan, you're already in a strong position to access this benefit the way it was designed to work. If you're on a Medicare Advantage plan, you need to ask before you need this benefit whether your plan will actually authorize it. And by the way, your plan may not authorize it for this year, but can turn around and change and authorize it for next year with an Advantage plan. So this is simply part of what you should be considering when making an informed decision about your Medicare. Now, before you go, I promised I would cover Medicare ambulance services. And this next part is important because there's a piece of misinformation circulating right now that may be costing Medicare beneficiaries money, and money you don't need to spend. So let's clear it up. So here's something my team has heard a lot recently. As a question of Matthew, I was told Medicare does not cover helicopter ambulances, so I bought a separate medical evacuation policy. Sometimes that policy may be useful. More often than not, it's simply not necessary. The reason people are buying it is often based on a claim that is at best incomplete and at worst flat out wrong. So let me tell you what Medicare actually covers for ambulance services. And that includes ground ambulance, air ambulance, helicopter, or fixed-wing aircraft. And then I'll explain when a separate evacuation policy might make sense and when you might be paying for something you don't need. So Medicare Part B covers ambulance services when they are medically necessary. And that is the key phrase, medically necessary. So what does medical necessity mean, medically necessary? It means that Medicare is expected to pay for emergency ambulance transportation in an airplane or a helicopter if your health condition requires immediate and rapid transportation that ground transportation cannot provide. I'll cover the basics here in a moment, but I also want you to be aware that Medicare has a separate publication on the details of ambulance services. You can find that publication linked below or in the resources tab of the MedigapSeminars.org website. And that booklet even covers when Medicare may cover non-emergency ambulance services, when the signing of a ABN form, an advanced beneficiary notice, may be required, and how to appeal if Medicare does not pay for the ambulance service. Under original Medicare, Part B generally covers 80% of the Medicare-approved amount for the ambulance ride after you meet your annual Part B deductible. Your Medicare supplement, such as a Plan G or a Plan N, may pick up the remaining 20%. And that means your out-of-pocket costs on a covered ambulance ride with a Medicare supplement may generally be very low and in many cases may cost you nothing. The ambulance provider must be Medicare certified. The transportation must also take you to the nearest appropriate medical facility that can treat your condition, not the medical facility of your choice. Those are the rules. Now here's where the helicopter confusion comes in. Medicare Part B absolutely does cover air ambulance transportation, including helicopter transportation, when certain conditions are met. The first condition is that you need immediate and rapid transport. The second condition is that the ground transportation would endanger your health because it would take too long or because the terrain or the distance or the location make ground transportation impractical or unsafe. When conditions are met, Medicare can cover the helicopter ambulance transportation. Medicare can also cover fixed-wing aircraft ambulance transportation. And the same basic 80-20 structure applies, and a Medicare supplement may help cover the remainder. So when someone tells you that Medicare does not cover a helicopter or ambulance, that statement is misleading. The more accurate statement is this: Medicare covers helicopter ambulance when it is medically necessary and when ground transportation is not safe or fast enough. Does Medicare cover every helicopter ride? No. If you're transported by helicopter when a ground ambulance would have safely handled the situation, then Medicare may deny the claim or may pay only what the ground transportation would have cost. And that is where many medical evacuation insurance companies get their sales pitch. They're taking a real edge case and turning it into a general claim that scares people into buying the product. So I want to be fair here. Medical evacuation insurance is not automatically a bad product. There are situations where it can be genuinely useful. If you travel internationally on a regular basis, original Medicare generally does not cover care outside of the United States. So if you have a medical emergency in another country and you need to be flown home, an evacuation policy may be worth considering, especially if it provides benefits outside of the United States. And you need to check the specific plan that you're considering. Some Medicare supplement plans, including Plan G and Plan N, include limited foreign travel emergency coverage, but that benefit has a lifetime cap and important limitations. If you live in or frequently travel to remote areas such as wilderness areas or mountains or off-grid locations where air evacuation may be more likely and standard Medicare medical necessity rules may not apply cleanly, the evacuation insurance might fill a real gap. But if you live in a city, rarely travel outside the country, and if you have original Medicare with a Medicare supplement, you may already have the coverage that you need for an ambulance ride to the nearest appropriate hospital. So before you spend money on a separate evacuation policy, ask the salesperson one direct question. How is this different from what my Medicare and Medigap supplement already cover? And compare what they say to what's in the linked booklet from Medicare to make sure it's accurate. But if they can't answer that question clearly in plain English or accurately, walk away. The bigger lesson here is the same lesson I want to come back to in nearly every video. With Medicare, the details always matter. Selective truth is how a lot of these products get sold. Medicare does not cover helicopter ambulance, sounds true. The full truth is that Medicare covers helicopter ambulance when it's medically necessary, and that protection can be real and substantial. If you're on original Medicare with a good Medicare supplement, you may be far better protected than most people realize. If you're considering a medical evacuation policy on top of that, just make sure you understand exactly what gap that you're actually paying to fill. So leave me a comment below. Have you been pitched a medical evacuation policy? Is the linked brochure on the medical and Medicare ambulance services that I put below, is that helpful? Tell me in the comments because I read every comment. Subscribe so you don't miss important updates regarding Medicare. I'm Matthew Clausen with Medigap Seminars, and I'll see you in the next video.